Rhabdomyolysis is a condition where muscle breakdown leads to myoglobin release into the bloodstream, causing kidney problems. In this video, we will discuss its causes, symptoms, diagnosis, treatment, and long-term effects, including medication and exercise-related forms, electrolyte imbalances, and ongoing research. Rhabdomyolysis typically arises from one of several interconnected processes, such as direct muscle injury, disruption of the excitation-contraction coupling, impaired energy metabolism, or defects in the myocyte cytoskeleton. The sequential events leading to myocyte breakdown, including calcium dysregulation, oxidative stress, and activation of proteolytic enzymes, will be discussed. Furthermore, the release of myoglobin into circulation will be elucidated, focusing on its toxic effects and the subsequent renal damage it can cause. This section will delve into the different etiological triggers of rhabdomyolysis, ranging from physical trauma and crush injuries to exertional activities and prolonged immobilization. Additionally, we will explore the role of specific medications, such as statins, fibrates, and certain antibiotics, as well as underlying metabolic disorders like inherited muscle diseases and metabolic myopathies. A thorough understanding of these risk factors is crucial for accurate diagnosis and appropriate management of rhabdomyolysis. In the clinical presentation and diagnosis section of rhabdomyolysis, we will learn how to identify the various symptoms and signs associated with the condition. We will also explore the importance of conducting a thorough clinical assessment using history taking, physical examination, laboratory tests, and imaging studies like ultrasound and MRI. Rhabdomyolysis is closely linked to the development of acute kidney injury, AKI, which can range from mild dysfunction to severe renal failure. We will discuss the underlying mechanisms contributing to rhabdomyolysis-induced AKI, as well as strategies for early recognition and management. Moreover, this section will address the potential disturbances in electrolyte homeostasis, hemostatic abnormalities, and cardiac arrhythmias that often accompany rhabdomyolysis, necessitating vigilant monitoring and targeted interventions. Prompt and adequate fluid resuscitation is the cornerstone of managing rhabdomyolysis. We will discuss the goals of fluid therapy, including the optimal volume, choice of fluids, and potential complications to be aware of. Additionally, we will explore the role of diuresis and the use of alkalinization agents to enhance myoglobin clearance and mitigate renal damage. Strategies for managing complications, such as electrolyte abnormalities, rhabdomyolysis-induced hypercoagulability, and cardiac arrhythmias, will also be detailed. Certain medications have been implicated in the development of rhabdomyolysis, and understanding their mechanisms of action is crucial for risk assessment, patient education, and appropriate monitoring. We will focus on widely used medications, such as statins and fibrates, which are commonly prescribed for lipid management. Additionally, we will explore antibiotic classes, such as macrolides and fluoroquinolones, known to potentially induce rhabdomyolysis. Monitoring guidelines and strategies for early recognition of medication-induced rhabdomyolysis will also be discussed. Intense exercise, particularly unaccustomed or excessive exertion, can lead to exercise-induced rhabdomyolysis. We will explore the challenges faced in accurately diagnosing and managing this variant, which may present with overlapping symptoms and laboratory findings. Emphasis will be placed on preventative measures, including appropriate training protocols, hydration strategies, and recognizing predisposing factors that need to be addressed. Treatment strategies, including rest, gentle rehabilitation exercises, and close monitoring for potential complications, will also be discussed. Rhabdomyolysis can be the initial presentation of various genetic and metabolic myopathies. Understanding the underlying pathogenic mechanisms, genetic mutations, and metabolic aberrations is crucial for accurate diagnosis and management. We will discuss specific disorders, such as myocardial disease, carnitine palmitoyltransferase deficiency, and mitochondrial myopathies, highlighting their clinical features, distinctive laboratory findings, and recommended diagnostic strategies. Genetic counseling and potential therapeutic interventions will also be addressed. In severe cases of rhabdomyolysis complicated by acute kidney injury and refractory electrolyte disturbances, renal replacement therapy, RRT, may be required. We will discuss the indications for initiating RRT, appropriate timing, and the various modalities available, including intermittent hemodialysis, continuous renal replacement therapy, and hybrid techniques. Special considerations in managing critically ill patients with rhabdomyolysis-induced renal failure will be addressed, focusing on fluid management, solute clearance, and metabolic derangement correction. Rhabdomyolysis is often accompanied by significant disturbances in electrolyte and metabolic homeostasis. Electrolyte imbalances, such as hyperkalemia, hypocalcemia, and hyperphosphatemia, can result in life-threatening complications. We will explore the underlying causes of these abnormalities and discuss